Greetings, fellow adventurers, and welcome back to my channel. Welcome, friends, to our video dedicated to antifungal. Let's dive right in and uncover its wonders. An antifungal medication, also known as an antimycotic medication, is a pharmaceutical fungicide or fungistatic used to treat and prevent mycosis such as athlete's foot, ringworm, candidiasis, thrush, serious systemic infections such as cryptococcal meningitis, and others. Such drugs are usually obtained by a doctor's prescription, but a few are available over-the-counter OTC. The evolution of antifungal resistance is a growing threat to health globally. In this section, we'll be shedding light on ocular and its impact on our understanding of the subject. Indicated when the fungal infection is located in the eye. There is currently only one ocular antifungal available. This is natamycin. However, various other antifungal agents could be compounded in this formulation. Now, let's shift our perspective and explore intrathecal from a different angle. Used occasionally when there's an infection of the central nervous system and other systemic options cannot reach the concentration required in that region for therapeutic benefit. Examples: amphotericin B. In the following segment, we'll be examining vaginal in greater detail. This may be used to treat some fungal infections of the vaginal region. An example of a condition they are sometimes used for is candida vulvovaginitis, which is treated with intravaginal clotrimazole. Brace yourself for a deep dive into topical as we explore its impact and relevance in our evolving narrative. This is sometimes indicated when there's a fungal infection on the skin. An example is tinnipedes. This is sometimes treated with topical terbinafine. Let's now turn our attention to oral and examine its role within a larger context. If the antifungal has good bioavailability, this is a common route to handle a fungal infection. An example is the use of ketoconazole to treat coccidioidomycosis. In this segment, we'll be unraveling the complexities of intravenous and exploring its multifaceted nature. Like the oral route, this will reach the bloodstream and distribute throughout the body. However, it is faster and a good option if the drug has poor bioavailability. An example of this is IV amphotericin B for the treatment of coccidioidomycosis. Now, let's dig deeper into classes and unveil the hidden treasures it holds within. The available classes of antifungal drugs are still limited, but as of 2021, novel classes of antifungals are being developed and are undergoing various stages of clinical trials to assess performance. As we embark on the next leg of our journey, let's unpack the layers of polines and examine its core elements. A poline is a molecule with multiple conjugated double bonds. A poline antifungal is a macrocyclic poline with a heavily hydroxylate region on the ring opposite the conjugated system. This makes poline antifungals amphiphilic. The poline antimycotics bind with strals in the fungal cell membrane, principally ergosterol. This changes the transition temperature of the cell membrane, thereby placing the membrane in a less fluid, more crystalline state. In ordinary circumstances, membrane strals increase the packing of the phospholipid bilayer, making the plasma membrane more dense. As a result, the cell's contents, including monovalent ions K, No, H, and Cl, and small organic molecules leak, which is regarded as one of the primary ways a cell dies. Animal cells contain cholesterol instead of ergosterol, and so they are much less susceptible. However, at therapeutic doses, some amphotericin B may bind to animal membrane cholesterol, increasing the risk of human toxicity. Amphotericin B is nephrotoxic when given intravenously. As a poline's hydrophobic chain is shortened, its sterol binding activity is increased. Therefore, further reduction of the hydrophobic chain may result in it binding to cholesterol, making it toxic to animals. Amphotericin B candicidin philippin 35 carbons, binds to cholesterol. Toxicamycin natamycin 33 carbons, binds well to ergosterol. Nystatin rimicidin. Moving ahead, let's uncover the hidden gems within azoles and discover their significance. Azole antifungals inhibit conversion of lanestrol to ergosterol by inhibition of lanestrol demethylase. These compounds have a 5-membered ring containing 2 or 3 nitrogen atoms. The imidazole antifungals contain a 13-diazole imidazole ring, 2 nitrogen atoms, whereas the triazole antifungals have a ring with 3 nitrogen atoms. Brace yourself for an enlightening exploration of imidazoles as we dive into its profound implications. Bifenazole, butaconazole, clotrimazole, iconazole, fentaconazole, isaconazole, ketoconazole, wuliconazole, miconazole, omiconazole, oxyconazole, sertaconazole, sulconazole, tuconazole. As we enter this new phase, let's navigate the complexities of triazoles and discover its practical applications. Albiconazole, efinaconazole, epoxyconazole, fluconazole, isavuconazole, itraconazole, pauconazole, propiconazole, ravuconazole, tertanazole, voriconazole. In the following segment, we'll be examining allylamines in greater detail. Allylamines inhibit squalene epoxidase, another enzyme required for ergosterol synthesis. Examples include butanafine, naphthafine, and terbinafine. As we enter this new phase, let's uncover the impact of echinocandins on our broader topic. Echinocandins inhibit the creation of glucan in the fungal cell wall by inhibiting 13-beta-glucan synthase and idilafungin, caspofungin, mycofungin. Echinocandins are administered intravenously, particularly for the treatment of resistant Candida species. As we venture forward, let's examine others in detail and gain a deeper appreciation for its significance. Acrosorcin, a marlfine, a morpholine derivative used topically in dermatophytosis orans, possess antifungal properties. Benzoic acid has antifungal properties, such as in Whitfield's ointment, Friar's balsam, and balsam of Peru. Carbofucin, castellanese paint, cycloprox olamin, hydroxypyridone, antifungal that interferes with active membrane transport, cell membrane integrity, and fungal respiratory processes. It is most useful against tinea versicolor. Cleoquinol coal tar coppery sulfate crystal violet atriomethan dye. It has antibacterial, antifungal, and anthelmintic properties and was formerly important as a topical antiseptic. Schlehexidin is a topical antibacterial and antifungal. It is commonly used in hospitals as an antiseptic. It is much more strongly antibacterial than antifungal, requiring at least a 10 times higher concentration to kill yeast compared to gram-negative bacteria. Chlorphetanol dihydroxyquinoline, hydroquinolfucitacin, 5-fluorocytosine, and antimetabolite pyrimidine analog fumagillin glycofulvin binds to microtubules and inhibits mitosis. Haloprigin discontinued due to the emergence of antifungals with fewer side effects. Miltefosine works by damaging fungal cell membranes. Nicomycin blocks formation of chitin present in the cell wall of fungus. Automide pyrimidine synthesis inhibitor. Pyrophthone olamin pentanenitrile potassium iodide preferred treatment for lymphocytinous sparatrichosis and subcutaneous zygomycosis basidiomycosis. The mode of action is obscure. Potassium permanganate for use only on thicker, more insensitive skin such as the soles of the feet. Selenium disulfide sodium thiosulfate sulfur tolnaftate thiocarbamate antifungal, which inhibits fungal squalene epoxidase. Similar mechanism to allylamines like terbinafine. Triestin hydrolyzed to acetic acid by fungal esterase under silenic acid and unsaturated fatty acid derived from natural castor oil. Fungistatic, antibacterial, antiviral, and inhibits Candida morphogenesis. Zinc pyrithium. Let's transition to side effects and uncover its significance. Incidence of liver injury or failure among modern antifungal medicines are very low to non-existent. However, some can cause allergic reactions in people. There are also many drug interactions. Patients must read in detail the enclosed datasheets of any medicine. For example, the azole antifungals such as ketoconazole or itraconazole can be both substrates and inhibitors of the P-glycoprotein, which among other functions excretes toxins and drugs into the intestines. Azole antifungals also are both substrates and inhibitors of the cytochrome family CYPA, causing increased concentration when administering, for example, calcium channel blockers, immunosuppressants, chemotherapeutic drugs, benzodiazepines, tricyclic antidepressants, macrolides and SRIs. Before oral antifungal therapies are used to treat nail disease, a confirmation of the fungal infection should be made, which cites approximately half of suspected cases of fungal infection in nails have a non-fungal cause. The side effects of oral treatment are significant, and people without an infection should not take these drugs. Azoles are the group of antifungals which act on the cell membrane of fungi. They inhibit the enzyme 14-alpha-sterol demethylase, a microsomal CYP, which is required for biosynthesis of ergosterol for the cytoplasmic membrane. This leads to the accumulation of 14-alpha-methylsterols, resulting in impairment of function of certain membrane-bound enzymes and disruption of close packing of acyl chains of phospholipids, thus inhibiting growth of the fungi. Some azoles directly increase permeability of the fungal cell membrane. Get ready for an enlightening exploration as we dig into resistance and understand its role in the broader context. Antifungal resistance is a subset of antimicrobial resistance that specifically applies to fungi that have become resistant to antifungals. Resistance to antifungals can arise naturally, for example by genetic mutation or through aneuploidy. Extended use of antifungals leads to development of antifungal resistance through various mechanisms. Some fungi, e.g. Candida krusei and fluconazole, exhibit intrinsic resistance to certain antifungal drugs or classes, whereas some species develop antifungal resistance to external pressures. Antifungal resistance is a One Health concern driven by multiple extrinsic factors, including extensive fungicidal use, overuse of clinical antifungals, environmental change, and host factors. Unlike resistance to antibacterials, antifungal resistance can be driven by antifungal use in agriculture. Currently, there is no regulation on the use of similar antifungal classes in agriculture and the clinic. The emergence of Candida auris as a potential human pathogen that sometimes exhibits multi-class antifungal drug resistance is concerning and has been associated with several outbreaks globally. The WHO has released a priority fungal pathogen list, including pathogens with antifungal resistance. I love interacting with my viewers, so leave me a comment and I'll do my best to respond.